Hi friends, Dr. Nancy Trimbley, putting the power and knowledge of your health back in your hands. I'm going to show you some rib stretches today. Now, the rib cage starts at your spine. And there's actual joints at the spine. There's actually 2 joints per rib. You have 12 pairs of ribs. That leaves a lot of opportunity for things to get messed up. The ribs wrap around, and the top 7 have a connection to your sternum. The ribs 8, 9, 10, 11, 12, they're either false or floating ribs, so they kind of connect in. But there's another joint then that can get messed up here. When you go to a medical doctor, if they diagnose you properly when you have rib pain, they might say something like you have costochondritis. And like you've seen in my past videos, when we learn Latin, that means that the cartilage of your ribs hurts. Well, hello, we knew that. So what do? Well, you might need rib adjustments, so find your chiropractor and have them check your rib cage. And you know what? I have had patients go thinking were having a heart attack, go to the emergency room, because the pain can be so bad. It does hurt more when you take a deep breath. That is the giveaway. If you are having a heart attack, it would be independent. The pain would be independent of whether you're breathing in or breathing out. But with rib pain, it is going to feel worse with a deep breath, a cough, or a laugh. So keep that in mind. So when you come to see us, we'll do rib adjustments, and we'll use likely some cold laser therapy to reduce the pain. When you get to the point where you're out of that acute phase and you're done using ice, and now we need to work on the muscles that are in between the ribs, those are called the intercostal muscles. These are some stretches you can do. And these are going to mostly work on the muscles that are in the sides and the back of your rib cage. So one of them, you do need a chair, and you're going to start this stretch standing, and you're going to bend forward at the waist. So I'm going to do that now. And you want to get a good bend here. So I'm not up like this. I've got my head between my arms. I'm doing my right side, so I'm going to keep my right arm and my right leg straight. I'm going to bend my left leg. And what that does is it creates a stretch all the way through the right side body. And you're going to hold that, and you're going to relax, and you can even kind of rotate your head and neck towards the opposite side, and that'll just give you a little bit more stretch. Now with any of these stretches, you want to hold, you want to relax, and you want to breathe, because the breath, getting the oxygen into the muscles, will help them to relax. So you want to hold that for maybe 30 seconds or a minute, and try to do both sides. Even if you're having pain just on one side, try to do the other side. One side might be easier than the other. And you can do this stretch 2 or 3 times every day. Remember, the ribs move with every single breath that you take. So they're doing a lot of work for you. So that's why you can do that stretch so often. The other one that you can do is you can get on the floor. And this stretch is good for a lot of things, for your lower back, your upper back, shoulders. What you want to do is you want to crouch way down as much as possible. Some people will not be able to do this because of knee problems or back problems. But if you can do this, if you can reach far forward and then start to inch your arms towards one side, and when you start to feel that stretch in the rib cage, hold that position and just breathe. And make sure you breathe deeply and slowly. And then when you've held that position for 30 seconds to a minute, longer if you like, go the other direction. And make sure to move slowly. And then come back to the center, and then inch your hands back. And you should be able to breathe more deeply, and you should feel better. So, bye for now, putting the power and knowledge of your health back in your hands.